Yeah, thank you again, all the doctors, for joining. We are just starting our live streaming on our YouTube channel. Just give us a few seconds and we're starting this meeting as well. Thank you. Right. Thanks again. And we are live on YouTube as well. Thank you so much again, all of you, for joining. And first of all, I'm very much thankful to Oshad. We have Mr. Shivam Singhi, founder of Oshad, with us for ensuring this CME. And I think this is the first time we have Dr. Swapnil Bachhao with us as a speaker. He is a very learned professional and practicing very exhaustively in medical cannabis. And we all are looking forward to listen from you to have your understanding and fundamentals. But prior to this, I would request Mr. Shivam Singhi, a young entrepreneur in cannabis industry, to share his views, his thoughts, his uh, maybe mindset behind Oshad. And first of all, congratulate to you guys. The quality is premium. We are getting feedback from the patients and many doctors across the industry that your quality is very good and patients are getting benefited. So again, kudos to you and your team for ensuring good quality as far as medical cannabis industry and medicines are concerned, because we all doctors are always looking for good quality medicines that should benefit our patients. I think that is the primary aim for all of us, and you people are ensuring that you have like delivered, and you have invested a lot in. I think you are the first company to do a lab investigation from a US lab. So without wasting much time, I will request Mr. Shivam Singhi to take the stage and brief about you, about your company, to all the audience, and then we will start the session with Dr. Swapnil Bachao. And I request all the doctors who are listening us on Zoom as well as on YouTube to share your queries on the Zoom chat. You want to ask something, you can raise your hand. After we will cover our general questions, we will be discussing that with Dr. Swapnil as well. Over to you, Shivam. Thank you.
Hi, Dr. Piyush. Hi, everyone. Welcome to our first virtual CME. I would firstly like to thank Dr. Piyush Janeja and Dr. Swapnil for making this CME possible. And Oshad welcomes every doctor and anyone who's participating in the CME. I'm very excited because this CME is particularly directed towards all the Ayurvedic doctors who are attending this CME. I really hope that by the end of our CME, you learn about medical cannabis, how to prescribe this medicine, to whom to prescribe this product, how yourself to become a medical practitioner, a medical cannabis practitioner in India. I think the scope is very big for this industry, and we've just started. As you all probably already know, medical cannabis has exploded all around the world. It maybe started from the US and it's spilled around Europe, and now Asian countries have also started adopting. And in a very short amount of time, you also must have seen that in India, a lot of new companies are cropping up in this space, making this dream of ours of just a few young individuals into a reality. And we are very close to achieving this reality with not just our company, but also other companies pulling their own weight and coming up with good products, you know, and associating with good doctors, because this is going to, it requires all of us in this ecosystem to push and make this possible. Um, I started Orchard almost a year ago. I started working on it. We figured out all the legality, the how to start this business in India, and over the pandemic it was extremely hard, but we had a lot of help. We had very good team and a lot of help from Dr. Piyush and a lot of his peers around, and they helped Orchard realize its own dream. We are obviously positioned as a very premium, high quality CBD brand. And not only we've spent a lot of time trying to create the best CBD, most premium CBD product in the market, we are the only company in India that is sending all our products to the US to get tested. And we keep everything transparent. All our lab test reports are present on our product itself and on our website. Uh, so we do come from a mindset of the Western, companies who believe in transparency with their consumers, with their patients, with their vendors, and we hope to bring that sincerity and good ethical practices in this industry, especially because this we feel this industry is still so new. It doesn't need to be corrupted by the old methods of how industries grow in India. We would like to keep this industry extremely clean, especially because the product that we're talking about is in such a gray area. We really want to make sure everything we do is very transparent and legally right now, Orchard has only started with our flagship product, which is our full spectrum Vijaya oil. And we come in 1500 and 4500 mg variants, which is just the strength of the product. And we've created 3 different flavors: natural, tulsi, and pepper. There is a lot about our products and our vision and what we do on our website, which is www.orchard.com, and our Instagram profile, which is orchard.wellness. We are present on all social media, and I would love to talk about my company, but today our agenda is to educate you and help you understand medical cannabis better. So I will be handing over to Dr. Piyush and Dr. Swapnil, who will be taking the CME forward. By the end of the session, if there are any questions for me, please feel free to ask. Thank you. Over to you,
Right.
Dr.
Right. Thanks, Shivam. And I think you have clearly mentioned about your vision, and I think the mindset which you are having as far as the quality is concerned is appreciated, and it reflects in your medicines. It reflects from the feedback we are getting from the patients, and as we all are dealing with tinctures right now, so definitely the same potency with lesser drops is a sign that quality is better, because if we are having, like for example, you have I think 1500 and 4500, and I'm using that in my clinic as well. So as a clinician, I can vouch that patients are giving feedback that the same potency now with OSHA, the drops are being reduced in terms of getting the effect, means the quality is better. And ultimately, it gives us as a clinician also satisfaction that yes, we are dealing with a good company having the mindset. Priority is the quality. And the lab testing, which you mentioned from US, is also a milestone which people have achieved. So thank you so much again for ensuring that. Please be with us. We have a couple of queries for you as well, as I can see in our in my WhatsApp. Couple of doctors have posted that, so I will be sharing that with you. First, let's again welcome Dr. Swapnil Bachhao with us, and he is a very learned professional. I can just quickly introduce to all of you. He is graduated from Volgograd State Medical University, Doctor of Medicine degree, and further he has pursued Masters in Health Administration from FDU, Vancouver, Canada. He is having a vast experience working as a medical cannabis physician, because Canada is a hub of medical cannabis, and if he has been there, so I think he has got that vast experience. And also he has worked as a drug safety physician with different CROs and pharmaceutical companies. Canada provided him the unique opportunity to be a clinical researcher and physician in the field of medical cannabis. With over 11 years of experience, treating patients with various acute and chronic ailments, specifically neurological diseases, depression, anxiety, insomnia, epilepsy, chronic pain, post chemotherapeutic pain, then loss of appetite, inflammatory bowel disease, and many other issues. So he's having that passion and interest in medical cannabis. So thank you so much again, Dr. Swapnil, for taking time from your busy schedule. We know that you are a busy clinician. First of all, my first question to you is, we have so many doctors I can see right now, around more than 600 doctors were there on YouTube. They are watching us live, and on Zoom also we have around more than 30 doctors now. So around 700 now we have touched YouTube. It's 691 I can see right now. So almost more than 700 doctors are watching you live. So the first, and by the way, this will be posted on our social media, on our Facebook page, where we have more than 2 lakh followers, mostly doctors again. So the first question to you is, what exactly the fundamentals of a medical cannabis practice you see, and you want to give tips to your fellow practitioners in India, that what kind of fundamentals or what kind of fundamental aspect they need to understand while they are practicing medical cannabis as far as Indian context is concerned.
All right. So good evening, everyone, and thanks, Dr. Piyush and Aushad, for having me on board here. So considering the fundamentals of medical cannabis, especially in India, there is still a lot of taboo in Indian society considering medical cannabis, even though it has been proven that, medical cannabis has been used in India since past 2000 years. It has mentioned in the Rig Veda and Atharva Veda, and it was used initially as a treatment, as an anesthetic as well. But in the past couple of centuries, it was considered as a taboo, and it vanished from our, medical literature. So I want to tell everyone that basically they should know that this is a plant from the Cannabaceae family, and it has these are three main plants. So they are divided into three categories. One is sativa, one is indica, and one is ruderalis. So these plants, they have different strains as well, and they have different compositions of CBD and THC. So what is CBD and THC? So these are cannabinoids which actually help us with several symptoms. And these are phytocannabinoids because they are derived from the plant, and endocannabinoids are the cannabinoids like anandamide, which is present in our human body naturally. Our body produces its own endocannabinoids. And when there is a disbalance in this endocannabinoid system in our body, we can see several symptoms like inflammation, depression, insomnia. Patients lose their appetite, and that is when you can supplement yourself with these external phytocannabinoids and bring a balance about your endocannabinoid system. And these receptors are present in almost every organ system of your body. So your daily functionality depends upon your endocannabinoid system, and that is why in almost every disease you can supplement it with this CBD and THC molecules, which will help you overcome your present ailments. And the scenario in India is that it is a budding, it's still in a very budding stage and in the infant stage in India. But I think we will get there slowly. And there are a lot of patients coming in who are very well educated, actually, considering how to use CBD and THC. When I first started working in India, say 2.5 years before ago, and I saw that patients were absolutely not aware, like, what is medical cannabis, what is CBD, what is THC, how to use it. But now the patients that I get or I receive are very well versed with, what is CBD and THC. They know what they are looking for. So this is a good thing, and I see that people are educating themselves in the field of medical cannabis, and the taboo that exists in the society is diminishing. As per my experience, I would definitely say in the next 1 year or two, we will have a lot more of medical cannabis clinics coming up, and Aushad is pretty much doing a very good job in that field because the products they have made are pretty good, and I have never got any complaint from any patient regarding any side effect using Aushad products till now, till date.
Right,
Yes.
right. Thank you so much for this input, Dr. Swapnil. We have another question for you. As far as medical cannabis practice is concerned, so what are the various challenges you feel like as a clinician? What kind of challenges, or maybe I will add on to this the second part. Maybe there can be some kind of side effects or some kind of contraindications. So please brief us and please let us know about the challenges, as well as, like, for example, we got this feedback from many clinicians that first time they want to introduce cannabis as a medicine, many patients are very negative about this herb. They think that they will get addicted. It's a drug. It's a kind of a drug addiction. We are starting to them. Or so these kind of challenges are there. And second is what kind of side effects we are expecting, or maybe we can give a brief about that side effects initially to the patient, so that they are aware that they will maybe getting dry mouth or any other issues which you want to explain, and what are the contraindications. So maybe you can brief on these aspects to all our audience. Thank you.
Yeah. So this is the main concern that even I have faced in my clinical practice: the reluctance to start on cannabis medication, because there is this it's stereotype in India that it's bhang and it's addictive, and it's kind of like nasha ho jayega, will I get high? So this is something that I would like to explain, that medical cannabis is very much different from bhang that you have, or recreational cannabis that you smoke. The recreational cannabis that you smoke and the bhang that you have, so you do not know what concentration of THC you're getting in there, and also the way it's taken. That is, if you smoke, you're definitely going to get high because it directly enters your bloodstream and crosses your blood-brain barrier. Whereas the medical cannabis, the dosing that we do is very regulated, and it is microdosing. We never give a patient a dosing that will cause these side effects. So definitely you can take medical cannabis without any hesitancy, but always under a guided physician who knows how to use it. And it should be with a valid prescription. Do not consume it without a physician's guidance, because there are some side effects when you take medical cannabis in a high dosage. The THC molecule, which is a psychoactive molecule. So if taken in a very high dosage, THC can definitely, initially it will cause some dry mouth, thirst. It is going to stimulate appetite, which I feel is a good thing, because a lot of patients, they have decreased appetite. But again, taken in a very high dosage, it can lead to toxicity, and toxicity of THC, you can see reddening of eyes. You can feel very tired, fatigue, and disorientation. And few patients who have very low blood pressure, they can experience palpitations and a racing heart. This happens only in cases where the dose that is prescribed to is, for example, like just 2 to 4 drops, but you are taking 25 to 30 drops.
Right.
So this is something that I have seen few patients experiencing it. But again, you should not worry. I mean, you should not get afraid of that. To contact your physician when you feel these side effects, and he will definitely help you out with that. So it is very important for you to take dosage as prescribed by the physician. And if you want to increase it, ask your physician, get his guidance, and increase it gradually. Never take medical cannabis in a high dosage in the first few days, at least.
Right. And as far as dosage is concerned, we got this like feedback also from many doctors that they are still confused. Although we have done certain trainings and certain CMEs and webinars in prior as well, but today, as we are discussing with you, and you are bringing some new perspectives as well to the entire discussion, so we would like to understand. And although it's not a one-day discussion, I can understand, and it's like it requires a lot of exhaustive experience, because dose is very dynamic. Still, maybe we can at least talk with respect to the couple of potency tinctures we have from Oshad, like 1500 mg and 4500 mg. So the doctors, because predominantly the community which we are right now talking are doctors, so we can talk openly about the dosage and about the because, and I need to disclaimer, I need to add a disclaimer that if any non-medical is listening to this, please do not do self-medication. Always do under guidance of a medical doctor, medically qualified doctor, as far as the dosage, and it's a schedule even drug, so you need to have a prescription, and a consultation prior to starting this. But right now, our discussion is as predominantly doctors are there. So I would like to understand, and all of us would like to understand more from you, that as far as the dosage is concerned, what can be the fundamentals or what can be the mechanism which you like suggesting to your fellow practitioners that they should follow as far as the tinctures, and like we have 1500 mg and 1400 mg right now in 30 ml packing. So in that scenario, maybe you can elaborate further on the dosage. Like for example, the queries are whether it is a gender specific thing we need to understand. We all need to understand, and we all know that it is also connected with the body weight, with the age, and with the indication as well. And also, please elaborate the sublingual form, how we have to ensure to the patients. And again, if we are dealing with pediatric age group, senior citizens, so please elaborate dosage on all these aspects to all of us today. Thank you.
Sure, we'll do that. So basically, tincture is the best form to be taken, and it is very easy to administer the dosage. So you need to place the drops below your tongue, close your mouth, hold there for 2 minutes, and then swallow it. So what we are looking for is sublingual absorption, and whatever remains in your mouth, you just gulp it down. So that is the right way to take it. But certain patients, they like to mix it with food and take it. That is also fine. But definitely, if you take it sublingually, the potency is much better. The bioavailability of the drug is much better. And considering the dosing, you need to consider the patient's medical history. Most important is how is the patient's blood pressure, because in certain patients who have a tendency for orthostatic hypotension, or his diastolic blood pressure is very low, in those patients, try not to start any medical cannabis at a high dosage. Always give them, start with 2 drops, not more than 2 drops. Uh, just maybe 5 to 10 milligrams, not more than that. Because certain patients, in certain patients, THC can cause vasodilation, and that can lead to a dip in blood pressure. So it is not going to cause any significant dip in blood pressure, but certain patients who are already on antihypertensives, mostly those patients are at risk of having a dip in blood pressure. So always check for the medications the patient is taking. Uh, Diabetic patients, you can give it without any concern. You don't have any concern with diabetic patients because it does help in decreasing your sugar levels. So if the patient's sugar levels are normal or a bit higher side, you can definitely give them. But if the patient's blood sugar level is low, very low, so that is a concern. Always ask the patient to have something, eat something, and then take the medication. Say eat breakfast or some food, and then take it 30 minutes after that. It's not related to the gender, male or female. The dosing does not depend upon that. Weight, yes, absolutely it does. But again, even if the patient, for example, if a patient is 80 kgs and another patient is 60 kgs, you also need to consider what are the symptoms. For example, a patient with pain will definitely need a bit higher amount of THC. You can always give him Aushad 4500 mg. You can start on that. But if a patient's predominant complaint is not pain, he's just looking for a general good health and good appetite, you can give him 1500 mg. That is basically, you need to categorize the patient based on his medical history. Patients with Most of the patients, when they come to you with anxiety or depression, never start them on a very high dosage. Preferably start them on 1500 mg, and then slowly, after using it for 2 weeks or 3 weeks, then you can graduate to 4500 mg. And also, the main difference in dosing comes when the patient is already used medical cannabis in the past, or is it taking it for the first time. Usually in the patients who have used medical cannabis in the edible form, or if someone has used it recreationally and are very using high THC, in those patients you can definitely start them on 4500 mg directly, because their body has a high threshold for THC. And if you are going to give them 1500 mg, it might not help them as much. So these are a few concerns where you can tighter the dosage And also never ask the patient to take high dosage in the first week. Every week he can increase by 1 or 2 drops, so that he do not have any side effects for that. And also the threshold for cannabinoids is different for every person. So it's not absolute that if you give a person 2 drops, he's going to react the same way the other person has reacted. So in those scenarios, the patient needs to talk to the doctor and discuss about how are the effects. And according to that, your doctor will definitely increase or decrease the dosage.
Right, right. Thank you so much, Dr. Swapnil, on this aspect. I request Dr. Lalit, Dr. Bipin, Dr. Razvi, just hold on for a few minutes more. We will request each one of you to raise your queries and we will add you to the session. And as I can see, you have raised hands. And I also request Shivam to be available. We have a couple of queries for you as well. Prior to that, Dr. Swapnil, there is one more aspect which we need to understand. And again, this is a very frequently asked question. As we know, the standard practices are there in neuropathy, in Navarpathy, in Ayurveda, allopathy, whatever. Still, we all are discussing and we all are watching for medical cannabis. Is there any significant benefit? Is there any specific benefits? Is there any maybe justification, logic, or whatever? See, we all know, but still in a clinical way and as to brief, because many times when we discuss, the clinicians ask why we need to add this to our standard of care. We are already giving these kind of medicines. So, what is the benefit or is the advantage of adding medical cannabis in your practice? So maybe you can brief us on that. And after
Yeah.
that, I have a couple of questions for Shivam also. So please, you be available after this discussion. We will be going to you, and then we will be taking the queries and questions from the doctors as well. Right, Dr. Sapne?
Yeah. So many patients that come to me, these are patients, they have already tried many medications in the past. They have
Right.
tried allopathy, they have tried Ayurveda, they have tried Unani. Some have benefited to some extent, some are not. And when I add medical cannabis to this, believe it or not, like within 2 weeks, the feedback is that they are feeling, they have never felt so good before. And they were using medication for the past, maybe say 10 years or so, but they have never felt as good as when we add medical cannabis. The main reason is the ECS, that is the endocannabinoid system, that is disrupted. It cannot be fixed by other medications. You see, so those medications, they can give a temporary symptomatic relief, but then it's not balancing your endocannabinoid system. Whereas when you take these phytocannabinoids, that is CBD and THC, it actually helps balances out your endocannabinoid system. And when your endocannabinoid system works, in balance, your other organ systems, your other endocrine systems, your hormone release, everything, that is also balanced. And you do not have any negative side effects using medical cannabis. That is the main thing. Like, we are taking painkillers, or if you're taking pills for sleeping, that is definitely in the long run going to affect your kidneys or your liver. Whereas cannabis, on the other hand, is going to support your other organ systems as well. So this is one main thing that I would say is that's why it is good to add medical cannabis to your other medications, so that it not only provides benefit but also reduces the side effects that you're having by taking other medications. Yeah.
Right, right. Agreed. And we'll be discussing a couple of questions with you again. But prior to that, I would like Shivam to add on to the discussion. You are there, Shivam? Right, I'm just adding you. So there
Yeah.
is a couple of queries from the doctors, and then I will go to all the doctors. I can see so many hands are there, and there are some questions in our chat box as well. So Shivam, a couple of doctors are asking that if they want to get associated with your company, so what is the procedure and how they can start maybe dealing with you guys? So is there any specific contact number, email ID? Maybe you can post in the chat box also for everyone, and otherwise you can elaborate. And do you provide samples? There was one more question, that do you provide samples to doctors as well? And is there any like specific doctor association model which you can discuss one to one with all the doctors? But at least you can inform that you people have that as well. And what other aspects you people are maybe helping the fellow clinicians who are getting associated with you? So you can brief on all those aspects to us. Thank you.
Of course. Thank you, Dr. Piyush. So when it comes to Aushad, our association with doctors can go in a lot of different ways. First and foremost, We have our online website. We have Dr. Swapnil and Dr. Piyush both as our onboard doctors who help prescribe this medicine to whoever comes on our website. And if they want to buy that product, they require some prescriptions. So that's one model of how we are working with doctors. We also are working with a lot of doctors who are keeping our product in their clinic, and they are dispensing those products from their clinics themselves. And obviously, we work on a good commission model with the doctors around this product as well. Then there is another way if there are doctors who are not very certain or don't have a clinics open at this moment, because I spoke to a lot of doctors and during Corona time, they've shut down their clinics. So we are offering those kind of doctors a coupon code, which when they prescribe this medicine to someone, they can you give that coupon code to that patient who will get a 10% discount on their product, and we have some sort of a commission model for the doctors for helping us spread the word for our brand. um, Beyond that, we are also just besides the orchard route, we are also just very interested in educating the doctors. So that's why this is one of our first virtual CMEs, but we also intend to have more CMEs offline and online, so that we can raise the level of awareness and also the practicing of medical cannabis in India, because we believe that the more the doctors and the doctor network of this sort of raises their knowledge about medical cannabis, it will be easier for the consumer and for the country to accept this product. Obviously, Dr. Swapnil and Dr. Piyush have been talking a lot about the benefits of this product, which we all truly believe in. So I think, until unless all the other doctors also start understanding the real benefits of this herb, of this plant, even though it's been, said in our Ayurvedic books for thousands of years, but I feel like we really need to re-educate all of us about this herb and understand the benefits of this. And once we all come on the same platform and raise the bar here, is when this industry will truly be established in the country.
Right. Great. Nice. Thank you again, Shivam, and definitely I request you quickly in the Zoom chat box. You can just post your email ID and maybe any contact number, official contact number which you people have, so that all the doctors are who are attending on Zoom can connect with you. And after this, or maybe right now also along with this, I will let me just post it on our YouTube channel as well, so that those doctors who are watching us live on YouTube you can check on the live chat, and after the session will end, I will ask my team to post in the comment box as well. So all of you can connect with uh, Oshad and the concerned person. Shivam is the founder of this company, so directly you can connect with him, and he will connect you with their staff, and they will help you in processing of your orders and your samples as well. Um, Dr. Swapnil, we have now a few queries and questions, and I request you to please take up that. And prior to that, we have few doctors also who are waiting for a bit long. I don't want to wait them. Dr. Alit Vyas, if you are there, maybe you can just ask your query. I'm just unmuting you, so you can ask your query quickly. You can just unmute yourself. I have ensured, or maybe you want to switch on your camera, you can switch on. You can unmute yourself now, and you can ask your query. And Dr. Bipin Joshi is also there. You can also ask your query if you want. You can just unmute yourself. Let me add you to the spotlight also. And Dr. Razvi, you can also unmute yourself. So each one of you, one by one, can ask your query. Any other doctor want to ask, please raise your hand. We will add you to the spotlight and you can ask your query. Dr. Joshi, you want to ask? Dr. Razvi, you want to ask, please? You can unmute yourself. We have enabled you. You can just unmute yourself and you can ask. Yeah, Dr. Razvi, tell me.
Yeah, 1 minute. Sir, I have one question regarding CBD, as I am practicing CBD. So I've seen the results also in the patients, and the past 3 months I'm using this CBD in the patient, and I want to know if I want one CBD clinic, what is the criteria to open a CBD clinic?
I think there is a
Hello?
network issue, so maybe you can just type your
Oh.
question.
Yeah, I'm not.
The-
Post my query.
Got the question?
Messages.
So, Dr. Rizvi, you can just type your question. I think there is some network issue. Dr. Vidya Satpathy, you want to ask? You can.
Hello.
Yes, please.
I have a question. What's the difference between opioids and cannabinoids?
Okay. You want to share inputs, Dr. Swapnil?
Yeah, so opiates are nothing but synthetic derivatives of the opium plant. Basically, also a plant derivative, but it's a synthetic derivative prepared in laboratories. So opioids are definitely more stronger for pain, but then they come with some side effects. So it can be definitely used for acute conditions, but chronically opioids do, deteriorate your condition. Like your renal profile will be deteriorated, and your liver function test will also be deteriorated. So on the other hand, if you use CBD and THC specifically in 1:1 ratio for pain, it will not cause the side effects that opioids cause. And these are not synthetic derivatives, so these are plant derivatives. That's the main difference.
Right.
Okay.
Thank
Thanks.
you. Dr. Bipin Joshi, you want to ask? So you can please unmute yourself and ask your question. And thank you again. There are several doctors who are sharing their details. So I request Shivam and his team, and we will also share these details with you guys after the session, but you can maybe note down the details and you can connect with them. We have another question, Dr. Swapnil, for you.
Yeah.
As far as the contraindications are concerned, and specifically people are asking that one question is regarding the contraindications. What are the contraindications in prescribing? Another question is related to that only. So is there any time gap in taking these medicine with other medicines like for hypertension, for hyperlipidemia, or for any other allopathic medicine? So the both questions maybe you can answer. One is the contraindication, like which medicines we need to avoid while putting patient onto the medical cannabis, and second is the other medicines if they are going on. So is there any time gap which we need to advise to the patients? Thank you.
So most of the patients, geriatric patients, especially if they are taking antihypertensives, then you need to be a bit more cautious and keep a gap of at least 4 hours if he's taking an antihypertensive, or at least 3 hours. That is the gap you need to keep. And also patients who are, post-surgery or on transplant patients and are taking any immunosuppressants like tacrolimus, for example. In those patients, you need to be more careful because CBD and THC decrease the metabolism of these immunosuppressants, and their level of immunosuppressants like tacrolimus and other immunosuppressants, paclitaxel, this can increase in the blood. So immunosuppressants and antihypertensives, you need to be a bit careful. But then again, if you are dosing them, microdosing them, and you're keeping a check on their blood pressure, then it's again safe to use in these patients as well.
Right, great.
So, yeah, other medications like diabetes medications and other medications, it's completely safe to take it together as well. No issues with that.
Sure. One more question. Any specific studies, cases, or any specific indications you want to highlight, or maybe a couple of your experiences with the patient, as you mentioned in generic form, that patients within a week or two are getting healed. But is there any specific disease or any specific indication which you want to discuss here? Maybe a couple of your cases, or maybe your most interesting cases which you can discuss with the fraternity, so they have some specific idea on how to proceed with the case and what to expect as far as the healing is concerned.
So I would start with a case that I had about a pediatric patient, 6 years old. And this patient had epilepsy, generalized epilepsy disorder. And she had epilepsy, she had seizures almost like 6 to 7 times a day. and she was taking other medications for this, but her condition was not improving as much as it should. But after starting her on CBD oil in the right dosage, slowly titrating it, by every week, she is doing much better now, and her seizures have almost completely disappeared. Like she still has seizures, but like say once every 2 weeks, and she used to have it like daily 6 to 7 episodes. So that is something I would like to share. And also patients, especially chronic pain patients and post chemotherapy patients, they have been on many painkillers and opioids for past maybe 6 to 7 years. And once you started them on CBD and THC oil, their pain almost completely disappears on the scale of 1 or 2 out of 10. That's it. So many patients who have depression, I would say, and were not able to sleep for the past 10, 15 years are, they actually message and thank me because the medical cannabis, that is CBD and THC, is helping them a lot. And they have never slept before, so, they never had a good sleep in the past 10, 15 years, which cannabis oil is providing them. So, but when you want to dosage of, obviously, as I mentioned earlier, you need to take a brief history of the patient, what are his present and past medical conditions, and what medications he or she is taking. So once you start her on cannabis, start them on cannabis and CBD or THC oil, after 2 to 3 weeks, when their symptoms decrease, you can slowly wean them off of their other medications, especially painkillers. But if the patient is taking any sleeping pills, never stop it suddenly. Always ask them to half the dosage after using it for 3 weeks, after using the CBD oil for 3 weeks. So these are certain cases, I would say. I mean, there are many cases to talk to. There are like at least 100 of cases which have, very good results after using CBD and THC.
Right. And just to add on to this, see, we need to also understand that there are several aspects when we are dealing with any particular case. And as Dr. Swapnil mentioned, that sometimes patient are coming after getting after they are exhausting all the treatment modalities. So we need to keep that in mind as well. But yes, we have also seen in our practice that so many cases are being healed, and they have not felt this kind of healing in prior as well. And as he discussed one case about the pediatric epilepsy and the seizures. So there are a couple of drugs in US and Europe approved on this indication as far as FDA is concerned and European regulators are concerned. We are getting so many queries, so quickly, as we have limited time as well. A couple of more queries. One is definitely this session is getting broadcast on our Indian Vaidya's YouTube channel as well. So those who have joined late, you can go there and watch the entire session. Hope this was useful and informative for all of you. So the next question is, Dr. Swapnil, that effect of CBD oil is long lasting. Is there any saturation at some point of time as far as CBD is concerned or cannabis is concerned?
So no, there is no saturation. You can continue CBD even for a year without any side effects. Absolutely no side effects. The only thing is that if you're going to use THC, at a certain point of time, your threshold is going to increase and you would need more and more dosing of THC. So in those scenarios, what you can do is after every month or two, you can give a break for 5 to 6 days and then again start your medication. What that does is it refreshes your CB1, CB2 receptors, and then again you can start with the dosing. And there are certain things, like simple things, like you can take vitamin C or you can take lemon water with some black pepper. That also helps in replenishing your, reviving your CB1, CB2 receptors. They respond more better. So just simple things. And CBD is something that has absolutely no side effects. The only side effect that is, we talked about dry mouth and dizziness. That is only if you are taking THC. CBD, absolutely no side effects.
Right, but in India we have generally full spectrum.
Full spectrum, yeah.
Also, it will have both CBD and THC. So I think we need to keep that in mind.
Definitely.
And definitely, scope of cannabis is there on autism and ADHD as well, Dr. Basu. And let me clarify, this was the first attempt we made, and I think we are very much successful. And I again congratulate Oshad and the entire team and Dr. Swapnil. What I suggest is, Shivam, let's have a regular now these kind of events, because I can see so much of interest from the doctors and they need
Absolutely.
specific discussion. So let's do one thing, and Dr. Swapnil, if you also agree, let's have disease wise maybe sessions. One by one we can discuss one or two diseases in a session, so that we can have more specific discussions. And maybe you can have some kind of a presentation, some kind of a like infographic, or maybe Oshad can also have some kind of infographics. I think you people have prepared one a flow chart and one dosage chart as well, which you can virtually show to all the doctors in the next CME. We can have that. Maybe next CME, what I suggest is let's have focused on the dosage, because dosage is another. I can see so many questions again coming up with the dosage. So let's keep it maybe every alternate week we can do one this kind of event with Oshad, and let's have a regular interaction with all of you. And thank you so much again for this very motivating response. By the way, we were not expecting this much on a very short notice. And the concluding remarks I would like to have from Shivam and Dr. Sapnil both. And to just to add one more thing, and we want that information from you as well, Dr. Shivam, that moving forward, what exactly you people are looking for as far as maybe expectations from the doctors, your maybe some coming future plans as far as the company, or how you are thinking and taking it now in future as far as medical cannabis, like maybe medicines or your company is concerned. So maybe you can talk on some more aspects on that, and then maybe you can have your conclusion remarks and vote of thanks for all the doctors. Thank you.
Of course. Thank you, Dr. Piyush. So first and foremost, I would like to talk about, as Oshad, what is our plan and what basically do we have a vision of for this industry and for our own company. Firstly, I'd like to point out that this particular CME was very much focused on full spectrum CBD oils. Our entire conversation was based upon that. And those were the questions and the queries that we were solving today. And I know that there are a lot more questions about that, and we hope to cover all of them either one-on-one or in another CME we'll hold sometime very soon. Um, as for Oshad, we don't think that we'll restrict ourselves to just one product. This cannabis is an extremely versatile plant. It can help people from various ailments, not just psychological ailments or epilepsy or even chemotherapy pains. It also is excellent for cosmetic uses. It helps you with various skin ailments, from dry and itchy skins to eczema. It can help you sort out a lot of, like, even things like migraines and headaches and appetite and overall gut health improvement. So we actually are aiming to broaden our product range into all of these areas. We specifically are looking to formulate certain products that are going to be topically used. We would like to obviously offer these kind of products to our doctors as well, to prescribe to their patients. Or a lot of the topical products will not require prescription, but they can still be therapeutic and medicinal in usage. And obviously, coming from an experienced medical cannabis practitioner, this product will obviously get a lot more sort of weight behind it. So there's a lot of big plans for us. We are already on our way to explore most of these things. I think by summer we should have at least 4 or 5 more products within our product range. um, was there anything else, Dr. Piyush? I'm not sure if I answered all of those questions.
So thank you so much, Shivam. And we have again shared Shivam contact details with all of you, email ID and phone number. We are getting so much of requests from the doctors that how they can start and what is the process of getting medicine samples and all. So please connect Shivam directly. They are very much open and looking forward to have an interaction with all of you. And again, thanks, Dr. Sapnil. And I can see, Dr. Sapnil, there are so many queries again popping up in our Zoom chat and our WhatsApp and YouTube as well. So what I suggest is let's draft a plan maybe for next 2 3 CMEs. We will have specific topics. The next CME, definitely I can see most of the questions are on dosage clarification. So let's have a specific CME on the dosage aspect in detail, for maybe some indications also you can guide. You can also guide in terms of the various age groups, and you can also guide on various kind of modalities in terms of with the full spectrum oil. So let's have a detailed half an hour discussion on dosage only in the next CME, and then accordingly we can take it forward. And every I think alternate week we can do this. And meanwhile, you need any specific information, you can connect with us. You have our email ID as well, that is info@indianvadyas.com, and you have the Oshad email ID, that is shivam@oshad.com. So you can connect to either of us, and we will be happy to help you in any further specific one-to-one query you have, and me and Dr. Swapnil will try to answer whatever the queries we can in our maximum capacity. So Dr. Swapnil, your concluding remarks, and maybe thank you again for joining us, and we are looking forward to have many more sessions with you in future as well.
Thanks, Dr. Piyush. Thanks, Shivam, for having me today. And I would just like to mention that the Indian society, the taboo that exists for use of medical cannabis should, it's not that what it is, how it's been perceived by the society. And I would feel that everyone should be more open to use it, and the fear should go away. That is the main concern. And the Indian medical cannabis industry is also very good. I mean, the products are good quality, especially for Aushit. I've never had any patient complaining about any side effects. So it's very safe to use, and I think every person can use it for their daily health as well, just not just for any other ailment or for disease, but for general well-being as well.
Right, right. Thank you so much. And the final note I want to add on to this entire discussion, and then we'll be proceeding for concluding session. And again, first of all, thanks all of you for joining, especially the doctors, pulling your time from your busy day schedule. The specific aspect which I really like about OSHA, this first time they have launched a medicine, cannabis medicine with tulsi flavor, which is very authentic and very Indianized version of medical cannabis practice. And I have seen so many patients are very much appreciating this particular flavor that the first time they are able to take, because sublingually we need to ensure that we are masking, and tulsi is like a kind of a herb or a kind of a flavor which most of the Indians are connected. So again, thanks for that innovative idea, that launching tulsi flavor in medical cannabis tinctures. I think that is definitely working well with many patients, especially the senior citizens I have seen, and they are very much suffering from pain. So I think these kind of innovations and these kind of ideations we are looking forward from the medical cannabis industry in India. And with this quality, we are very much like confident that we will be taking up to the next level. And I again thanks all the doctors, and definitely we will be having next CME with much more detailed information, and each topic will be covering. And I request Dr. Swapnil to elaborate each topic, and we will also be coming up with more and more details, and OSHA team will help in creating nice infographics and nice presentation, so that all of you can have some kind of an handouts, some kind of a quick reckoner to brushing up your knowledge. They're already working on that, so I request all of you just drop an email to us, and we'll be sharing some PDFs and some literature and reading information and reading material to all of you, so that you will be our aim and our idea is, see, sales and business is definitely required and significant, but that is the secondary objective for all of us, including Shivam and Oshad. The primary objective is to disseminate the knowledge and information, and to make all of you aware, and create a bouquet of people who can discuss and who can share. Like for example, Dr. Swapnil, with so much of vast experience, the openness, the transparency which he has shown in this today's session, I again appreciate him, because there are so many people who are doing, but we have seen that some of them are not that much open to share, and he's very much open and transparent. So that thing we require, and we need more and more Dr. Swapnil with us, so that all of us can grow together and take it forward. So on that note, I again thank all of you, and please keep supporting us, and we will be definitely sharing soon the next CME information with all of you well in prior. And please join us, and please spread this to all your friends, juniors and senior as well, so that they can also join and take maximum benefit. And this entire session will be available on our YouTube channel. You can go and see the link there, and you can rewind and see from the initial part. And there were so many good questions discussed initially as well. So thank you again. Thank you, Shivam. Thank you, Dr. Swapnil, for joining us today. And
Thank you,
all
Dr.
the viewers
Piyush.
as well.
Thank you, Dr. Swapnil.
Yeah, thanks a lot. Thanks. Yeah.
Have a good night, everyone.